vaccinated against COVID-19. We know many are choosing not to receive the vaccine, and one nurse tells us she was terminated by Eskenazi Health because of that choice. Fox 59's Lindsay Stone joining us now from the newsroom this evening. And Lindsay, so what is that nurse saying to you about this?
Adira Allen believes she was forced between making a decision for her job or her family. Adira Allen says she was a nurse at Eskenazi Health working in the COVID intensive care unit until earlier this week. Months after learning she was pregnant, Eskenazi Health announced a mandate requiring all employees get the COVID-19 vaccine or risk being terminated.
Doctors were recommending and still are recommending for pregnant women to get vaccinated, but I feel like a recommendation is not without risk.
After experiencing a miscarriage in December, Adira says she chose not to get vaccinated, worried about how it would affect her unborn child.
So I filed a medical exemption with Eskenazi and it was denied.
Adira tells us the hospital denied her medical exemption over the phone and not in an email after the most recent cybersecurity breach. The hospital system did confirm their email system was down, but did not comment on the communication between employees.
So I asked them if I could do weekly testing, what could I do to keep my job, or if we could discuss this after my pregnancy. And they said no.
Adira claims she was told verbally on Monday she was not allowed to return to work without proof of vaccination.
And you have a mandate set in place, but no paperwork to give us to say, like, are we suspended? Are we terminated? There was no communication other than you can't show up or you'll be removed.
We requested an interview with Eskenazi Health, but was sent a statement instead. Part of that statement says that as of September 21st, employees who have chosen not to be vaccinated have been suspended pending a final review. We asked how many employees have been suspended or terminated for choosing not to receive the vaccine, but they did not answer our questions.
Is always talk to your doctor, but recommendations right now are to be vaccinated.
Thomas Dazinski, an infectious disease expert, says there are no known risks for pregnant women associated with the vaccine.
The child may receive some of those antibodies and hold them for a short period of time, but eventually that child will want to be vaccinated as well. We do this for measles and mumps and rubella and other diseases as well.
Still, Adira says she wants to see years of research on the vaccine before deciding to get vaccinated.
I'm not against it, but I do think it's not a one-size-fits-all medication. I do think there are exemptions and people who are more at risk for getting it.
We will continue to demand answers and bring you more updates as we learn more about this developing story. And you can read the full statement from Eskenazi Health on our website, fox59.com. Reporting live in the newsroom, Lindsay Stone, Fox 59 News.
Lots to stay tuned for. Again, thank you so much, Lindsay. And just last week, we did tell you that more than one